Good evening, and welcome to all of you. Thank you for your interest in tonight's program, Home and Health. My name is Keith Rose, and I am your moderator for this evening. This is our 42nd event, our 7th year, and this is the first in our series for the 22-23 years. So welcome, and so glad you're here. You're either here in person at the MCC. There are some people who are watching us on TV through one of the Rogers channels, and that's available across Simcoe County. And then there's a whole slew of people who are streaming us live, and that you don't need the Rogers service for. So to those out in electronic land, welcome too. Now let me introduce tonight's 4 speakers sitting in front of me here, all looking very serious. They were laughing upstairs a couple minutes ago. More detailed biographies are in the program, which was online, and if you want to look at it after the event, you're welcome to do that. Nathan Sykes is on my left here. Nathan is the Chief Executive Officer at the Guest House Shelter in Midland, where the homeless can find a bed for a night. Nathan sees homelessness absolutely every single day. And on the weekends, he's working now, too. Yep. Okay. Glenn Lucas works with Wendat Crisis Center Services. Wendat is an organization in Midland and Penetanguishene dedicated to helping seniors and those with mental health and addiction problems. Welcome, Glenn. Suzanne recently joined Chigamig Community Health Center as their executive director. She has a world of experience working with people, working well with people. That's what I hear, Suzanne. She participated in one of our previous Our Health programs, Outrunning Cancer, 3 years ago. Welcome back, Suzanne.
Thank you.
And Gord McKay, I don't know whether you need an introduction, Gord, but I'll do that anyway. Gord is the retired mayor of Midland. He retired in 2018. He's always had a strong interest in the homeless population, one of the initiators and the volunteers for the Early Out of the Cold program, which is the precursor to the guest house that Nathan's looking after now. So welcome to all of you. We're glad you're here. I also have some thank yous. First of all, to our advisory committee. There are 6 of us who are actively working on that committee to plan programs. But tonight, specifically to Larry Arnold, who's been working on this program for almost 6 months. Thank you, Larry, for your passion and energy behind this and willingness to change along the way. So we have 7 local sponsors who I will acknowledge individually a little later on in the program. And to the extraordinary staff here at the MCC, our advertising people, promotion people, Michelle, Glenn for his outstanding AV activity, and I'm trying to figure out whether he wants me closer to the microphone or farther away, but we'll get that right, won't we, Glenn? And to the volunteers at the box office and to all the volunteers who took you to your seats tonight. Thank you very, very much. We couldn't do this without you. And I want to mention Josh Katova. Josh is our Rogers TV guy. Where are Rogers TV? Because you don't see any big cameras, right? Well, the cameras are now all in the walls, kind of creepy, eh? But technology is wonderful. We get better views, easier to use, and less people to manipulate those cameras. So, Josh, thanks for all you do for us each day. The evening is going to be slightly less than 90 minutes, and this is going to be a discussion between the speakers and between me and the speakers. We don't have a fixed agenda. We have an order. This is not scripted. I have received questions. Not only did Larry put together a series of questions, but several of our committee did, as well as a few from the audience. So I have those questions. At one point, we used to save them all till the end. I actually like putting them in when we're talking about what you do, and so we'll include some of those questions in our discussion, in our discussions. Okay, and if we have time at the end, we may have some joint questions and things like that. So. My opening comments, I'll keep them very brief. Our objective tonight is to help you understand the definition of the many sides of homelessness. Sorry, just the many sides of homelessness. We want to give you some definitions of what homelessness is, because it depends on how you define it, and that makes how you count it and how you look after the people. We want to give you a view of life on the streets to help you know who's trying to make a difference right now. And then to get more creative and better understand the ways to help and potentially initiate change. Been a lot of literature, a lot of press, a lot of media lately about the homeless population, and I hope tonight we can run through those 4 objectives, and at the end, you'll feel we've accomplished our goal. So, let me pass on to those who you want to hear, rather than me. First of all, Nathan, do you want to give us a little idea of the demographics of about how many homeless people and how you define homeless people?
Sure. Start off with an easy one. Throughout Simcoe County, every 2 years we do an enumeration. And what that really means is the organizations who work with people experiencing homelessness come together and over the course of 3 days try to go out and count as many people experiencing homelessness as possible. In our latest enumeration, we had around 750 people that were counted. But keep in mind, that was also during COVID when we did not have volunteers and we had limited outreach because of the time that we did it. It was also in January, so it was quite cold and harder to get out. But for us, we consider anybody who is without a permanent home to be experiencing homelessness. And that includes people who are couch surfing, people who are living in a temporary accommodation such as a motel or a hotel, anyone who doesn't have a permanent place where they can lock a door behind them.
So do you feel that enumeration was accurate, or are there considerably more people that are actually homeless?
More people.
More people.
Yeah, it was definitely an underrepresentation. But even with that, it was the highest count that we've ever had in the 4 enumerations we've done since 2016.
Okay. Thanks for giving us that. Tell us about the homeless. What's it like to be homeless? When you meet somebody, what kind of people are they? Like, just walk us in their shoes for a while.
Well, I guess the easiest way to think about it would be if on the way out right now, we took all of your house keys and car keys and your wallets and we said, good luck, try to make something work. The panic, the anxiety, the hopelessness, the desperation, it comes very quickly. For a lot of people who experience homelessness, it is a gradual process where quite a few experiences in their life lead them to that point. But for others, it is the rug that gets pulled underneath their feet. And we actually saw that quite a bit during COVID, where a lot of landlords took advantage of a very hot housing market, put their house up for sale, and an individual or a family who found themselves housed and felt fairly secure in that housing was suddenly told you had to be out. And then what they were faced with was a housing market where rent 3-4 years ago when they took on the property was $1,700 a month for a 3-bedroom is now over $3,000 a month and unaffordable. And so just like that, you can go from housed to desperate and on the street. And that really also, I think, tells a lot about how the mental health deteriorates in people who are experiencing homelessness. It also happens fairly rapidly. There really is a desperation, and we can see how people turn to activities and behaviors that we might consider destructive, such as addictions, to cope with the reality of being on the street and not knowing how you're going to get out of it.
So they've talked about this being a vicious cycle. Let's take the mental health addiction issue. Does homelessness cause that, or do they become homeless because of a mental health and addiction?
Well, I think we have to look at nature versus nurture. Certainly, physically, we can look around the room and we can all tell one person from another because our DNA, our genes all give us a slightly different blueprint. And what a lot of people don't realize is that mentally, emotionally, cognitively, we all have that same uniqueness about us. And so everyone is built differently. And so given that, I like to think of a glass of water where we all have sort of a hypothetical glass of water inside of us. Some of us are born and the glass is completely empty. Some have a couple of drops. Some of the glasses are half to 3/4 full. And so as we go through life, we all encounter stress, and those glasses fill up. And if we encounter enough stress for long enough, that glass will overflow. And that's when we start to struggle day to day. That's when we start to have breakdowns, and we start to see people who experience anxiety disorders, mood disorders, depression. And so for those who maybe start life with their glass half full, there is less stress that they can take on before, and then there are the other people who are jumping off cliffs and never seem to have their glass get full. And so we do have to look at those hereditary factors, and then the environment in which you're brought up, what you consider to be normal as a child. If you grow up in a household where there's poverty, where there's discrimination, we look at our Indigenous peoples and the type of environment that they grow up in and normalize, and then you can see how that perpetuates that cycle from generation to generation. And so, sadly, the hardest group of people to work with are those for whom a lifestyle of poverty and homelessness and struggle has become normal to them, because they tend to have the least amount of motivation to remove themselves from that lifestyle. And a lot of times it's because they don't feel that they deserve anything better than that. Whereas people who find themselves plunked into homelessness due to situational factors, often they have the support systems, they've grown up in a home or in an environment where they've developed resiliency skills enough to get themselves out of that situation with minimal help or with a shorter period of time.
So you're kind of talking about two groups of people broadly. One that has some characteristics that would suggest that this is just a short-term stay with you. Others that they'll be back.
Yeah.
Can you figure that out at the get-go pretty well, or? And
Yeah.
do you treat them differently?
No, we don't treat anybody differently. Everybody who comes to our door is a person who's going through a tough time, and we do our best to meet people where they are, physically, mentally, emotionally, cognitively, and our definition of success for them is their definition of success. So everyone who comes has a different desire and a different outcome that they would consider to be successful for them, and our job really is just to help steer them in the right direction, to provide them with the opportunities to achieve that. But there definitely are different types of people who walk through the door who come and ask for help. Some are families who are just hanging on to housing, and others are those who have been on and off experiencing homelessness for years.
Tell me, you've talked about the guest house here in Midland. Are there other facilities similar in Barrie, Collingwood, Orillia, that just by a different name? Is that right?
Yes.
And what are they? Busby in Barrie and?
Yeah, in Barrie, there's the Busby Center, who really works with individuals. There's the Salvation Army Bayside Mission, who works exclusively with men. Salvation Army also has a family shelter in Barrie, and then there's also Youth Haven, who works with youth between 16 and 24. In Orillia, there's the Lighthouse, and they serve pretty much everyone. In South Simcoe, there is Shift, and then there's also Home Horizons in Collingwood, and they are the emergency shelters. But then there are also transitional shelters that are sort of the next step for people who sort of graduate towards housing, but maybe for one reason or another aren't quite there yet.
So how many years has it taken these shelters as it's almost a stopgap, temporary, gets a roof over somebody's head, get them out of the cold, and then we'll get to the other things. But how many years have we been dealing with shelters?
I think actually Youth Haven was the first shelter in Simcoe that opened. It was 1987. I could be wrong about that, but most of them late 80s, early 90s.
Gord, any recollection of when you remember this?
Well, the Out of the Cold started roughly about 2005.
Okay.
So I was there for 30 years, and back then it was a van that went around from church to church, and the homeless had to essentially follow the service.
So prior to that, what do people do without a shelter?
Well, a lot of times they will travel to cities and towns that have those services. Midland did have a shelter in the 90s that closed down. And so for several years there was nothing here, and that is where Cities like Barrie do find themselves even more burdened than they already are with people who come from rural areas and other areas that don't have a shelter per se. And we are seeing more people coming from the Muskokas where there are outreach services but no proper shelters.
Proper shelter. So you're some intake from there. Yeah. What I'm trying to get at is there must be people that say shelter life's okay, but I don't want to live in a shelter. And then where do they go to live?
Well, that's the biggest problem that we're facing right now is there is very little in the way of rental and housing market for people to go. Our biggest crisis is affordable housing. And that's the thing that we're seeing is people come into the shelter and we don't really have a good plan for them to exit.
Mm-hmm. Talk about the encampments, which are the tent cities. Yeah. And we've seen the paper talk about in Toronto and through some of the bigger cities where these tent cities grow up in municipal parks, and they send a bulldozer in to clear them. Do we have a similar situation here, or is that a potential to come?
Oh yeah, we do.
Okay.
Yeah, we have several encampments. Their locations are not made known because we do not want bulldozers coming in and clearing them out. There's a lot of misconceptions about what purpose they serve. These are not people who are camping. This is not a recreation for them. They don't get to go home at the end of the weekend and take a shower. This is survival. This is where people live because they have nowhere else to go. The thing about an encampment is that there is safety in numbers and there is power in numbers. So if you find yourself with a group of people that you trust, it is much safer than being outside alone. And so, you know, we all want acceptance. We all want to feel important. We all want to feel a part of something. And even if that is joining an encampment where there is no other choice. There are certainly more people experiencing homelessness in our community than there are beds for them to go. And so at some point, people do have to figure something out for themselves.
Okay, thanks for that discussion. Tell us a little bit about the facilities you have at the guest house. And I had the privilege of going to the guest house before tonight, and Nathan showed me through, and it actually, I was, wow, you've got a really nice facility. It's not luxurious, but it's clean, it looks healthy, it's got a kitchen, got bathrooms, got showers. Tell us a little bit more.
Yeah, we always try to focus on the word dignity with the people who come to stay with us. It's not fancy, it's not luxurious, but we want everyone to feel like someone when they come. And we want everybody to know that homelessness is, it's situational, it's circumstantial, and it does not have to define them. And so we want the place to be nice because we want people to know that too often they're swept under the rug and they are told not here, the bulldozer comes in, go somewhere else, and there's a lot of stigma still and discrimination, and so we want them to feel welcome there. We call it the guest house. They are our guests. They are not our clients or our participants. They are our guests, and we want them to feel welcome. And so it's really important to us that we follow our two main missions, which is to provide people with shelter and with food. You know, one of the biggest determinants for health among those who experience homelessness is good food, it's nutrition, and so we want to make sure that we can at least cover that for people while we work with them to connect them with our community partners to get more supports.
Now, if I recall, this is just a nighttime shelter. They can't stay there in the daytime. So what do they do in the daytime?
Well, we do work with people throughout the day on housing, employment, education, but for a lot of people, they actually, it's funny because before COVID, when people would say, all right, I'm leaving for the day, they would go about their day. They would go to the library, they would go here and there, and we wouldn't see them again until dinner time. But when the pandemic started and we really focused on keeping people at home and sort of isolating people, there's since been quite a disconnect with the larger community. And a lot of our guests are not sure where to go or what to do with their day. Services have changed, and certainly the landscape of a community is different. It's not as easy to go into a Tim Hortons and just sit there for a couple of hours because there's so much mindfulness of social distancing and physical distancing. So a lot of times that is a challenge for them during the day as well, is meaningful activity that allows them to take their mind off their situation, to improve it, to develop some better social skills. And hopefully to come across a situation where they might find themselves in an opportune place for employment or for housing or for education. So that is definitely another challenge we have right now.
Do you have a series of rules for people that come and stay? For example, if they've got a record of previous altercations and fights at the guest house, you kind of say, we're full tonight, or do you welcome everybody? How do you, I'm sure they're all different.
Yeah.
So what do you do about the rules at the guest house?
Well, we do have a couple of rules. Mostly we have expectations. And I think the difference is that a rule is set in stone and it's really there and you really can't break it. Whereas an expectation, we appreciate that when people show up at our door, that can be the hardest thing they'll ever have to do in their life. To be an adult, to grow up in a society where we expect everyone to grow into independence and sort of do their own thing. And so to be an adult, to be a youth, to show up and say, I can't do this anymore, I need help, is a very vulnerable place to be. And so we recognize that we have expectations that we'd like people to respect, but that there's a lot of people, there's a lot of context. So really safety is the only boundary where we take it very seriously. Someone who has had physical altercations, we would have to talk about as a staff what we feel safe providing them in terms of services. But actually, incidents of that are extremely low. I think there's a perception that there are violent places based on TV shows or I guess just hearsay, but there's very little of that. For the most part, they're grateful for the roof over their head and the food and the support. And there's actually a lot of camaraderie that takes place in the shelters where they recognize that they're going through similar things as other people, and it can actually be quite a bonding experience.
Do you want to talk a little bit about the funding for the shelter? You can't charge people money. There isn't any money to be had. You've got staff working there. You've got people that you've got food to prepare. I know you have a lot of volunteers that work there, but how do you manage that?
Yeah, it's an interesting business model because we provide services to people, but they're not the ones that pay us for those services. And that is the challenge of the not-for-profit world, is to try to reach out to the community and ask for them to support the services that we provide to those who, for the most part, may never find themselves in a position to pay it back. And it's definitely a struggle. There are funds, there are causes that really come close to all of us, cancer, dementia, where they do a great deal of fundraising and they're very successful. And as much as there is a selfishness and there's philanthropy behind those donations, there's also a certain amount of, it pays back for the person donating, because we all know that we're vulnerable to these things, that we could be affected by them, and we're all hoping that our donation will help find a cure and provide us with relief. Whereas with homelessness, there's still very much an idea that it won't be me, it won't happen to me, it's somebody else. They got themselves into it, they have to get out of it. And so it is definitely challenging to compete for mental health and addictions and homelessness with physical ailments. But we have a great community. We have a lot of volunteers, we have a lot of supporters, and we just try to come out. And we're grateful for opportunities like this where we can have the discussion. And try to shed some more light on who the people are that experience homelessness, how they got there, and how we can help together get them out of that.
If they have medical problems, how do you manage that, or Nathan?
Well, we try to connect with doctors, with primary care physicians. We definitely do a lot of case management in the community, work closely with partners like Chigamik, and the local hospital, and it is tough though, because even seeing a primary care physician, a lot of the reasons why people go and see the doctor is related to medications that have a mental health component to them. Physical ailments are actually a lot easier to deal with. We have a good relationship with our community partners to do that. But it's tough because a lot of times if you're out on the street, the physical or the ailments that you suffer are chronic. And so you can relieve them, but you don't necessarily cause them to go away until we can find someone housing.
Okay. This is just a segue, or a brief introduction to what it's like to be homeless, and I'm sure we'll get back to some of the questions. Thank you very much. And I think it's probably a good time to talk to the partners. Glenn, do you want to go first and talk about your role at Wendat and how, when you meet a homeless person, how you start the conversation and what things you're looking for to help them get beyond because you don't provide shelter at night.
No.
Your job is to get them to the next phase. So what do you do?
So my role at Wendat is I'm the program supervisor for case management and crisis services. So I oversee the case management team, which we have 9 case managers, 1 brief service worker. And then I oversee the crisis team that we have 2 full-time staff at GBGH in the ER, and then I've got right now 7 part-time staff at GBGH. And I've got 2 full-time CMART workers, which is the North Simcoe, oh, I'm yelling now, North Simcoe Crisis Management and Resource Team that work with the OPP, right? So I've got 2 social workers that are partnered up with an OPP officer that get called out into the community for mental health calls.
So tell us a little bit about that, because we had an evening here to talk about 911, and there was Lisa Longworth, who works with the OPP in terms of implementing the medical response team, crisis medical response teams, I think they call them, and she highlighted the one that was working at Wendat. Just tell us a little bit about what they do, when they're called, and
So-
what's the rationale behind it.
So if there's a call to the OPP, someone may be concerned for a loved one or a partner because maybe they're suicidal or something like that, that response team will be called out, right? So that the social worker can go there, they can de-escalate situations, they can talk to the person, give them community resources, and work with them to come up with a plan so that they're going to be safe, right? If that doesn't work, then they can actually transport them to the hospital to be seen by our crisis team there, and then possibly to a Schedule 1 facility to get the treatment that they need.
So to give us an understanding, or a better understanding, what was it like before you had the mobile response team and the crisis management?
So
this way?
in reality, looking at statistics, the deferrals from the ED, right? So, them going out and just actually meeting people where they're at and de-escalating situations. One, we're getting less mental health clients being harmed because, OPP officers who aren't trained with mental health, they can be kind of rough.
So my impression was it was not only the OPP weren't trained, you were taking them up to GBGH where they weren't necessarily, well, they're trained, but they didn't necessarily have the time in the emergency department
Right.
to sort through this issue.
Yeah,
And
and
some
that-
of those problems have gotten better.
That's the biggest issue. So that has gotten better. So it's deferred people from the ED, so it's not overwhelming the staff there, right? So we have crisis workers on staff from 9 a.m. to 9 p.m., Monday to Friday, 9 to 5 on the weekends, that will deal with mental health crisis in the hospital.
So if you identify an individual, Glenn, that needs more help, do they get the services at Wendat? Do you refer them elsewhere? What kind of, give us a picture of what that looks like.
So we do a discharge plan of care in the hospital, tailored to that individual's needs, right? So in reality, if they need a doctor or a physician, we may send them back to our brief service worker at Wendat to help fill out that paperwork, because a lot of the times, a lot of the people that we're seeing are homeless, so they don't have access to telephones, right? So if we set them up with community supports and they can't contact them, especially over COVID when everything was basically done, virtual, it was very hard for them to get those supports. So if they come, if we send them back to our brief service worker, she will work with them in person, make the phone calls that they need to do. She also has set up a program where we will give phones out to those that need them, right? And set that up. The whole aspect of that is holistic approach to doing things. Now, we get people that come back to the ED quite repeatedly, right? So there's another program in our town which is called the North Simcoe Situation Table. Actually, most of the people here sit on the steering
Tell us about
committee.
the situation table.
So the situation table is basically most community partners in our community are on board, are trained. There's certain training you have to do to be a part of it. We sit once a week And if there's somebody in our community that is falling through the cracks, that does need help, that's having mental health issues, that's having homelessness issues, having issues with CAS because of children's needs, pretty much doctors, they've fallen through pretty much all community resources. They get presented by, community partners at the table, and then we will kind of vote and say, yeah, they need to go on to the next stage. And then we will pick the community partners that would benefit them the most to sit on there and do an intervention eventually, right? So it helps, like Chigamec is a strong proponent because they help us hugely. Jeff Graham sits on there and they get them, nurse practitioners and healthcare set up. Natalie Port, she works at the guest house and she will set them up, in the shelter, right? Or if there's nothing here, she will maybe make phone calls, to other shelters in North Simcoe to find a place for them to go. Right.
Do you have services that help people find financial assistance? Because I was surprised, I guess maybe shouldn't have been, but a fair number of people that are homeless do have some money. They just don't have enough money for food and to put shelter over their head, but they do have some money, so they're getting it either from the GST tax credit or from rent subsidies or other subsidies. Do you help them find that money?
Absolutely. We'll try to set them up with OW or ODSP, depending on what their needs are and what they qualify for.
Okay.
There's also something called a Discretionary Fund, which is through 211. So if somebody needs emergency funding, we will help them, make that phone call and do that intake. And then the money is actually sent to Chigamec, and they go to Chigamec and pick it up, cash, right? So we will work with them to whatever their needs are and try to fill those in, utilizing community partners as well.
Tell us about the other organizations. So you talked about Chigamec, and you've talked about the OPP. You can talk a little more about the OPP one. What other organizations do you work with?
Pretty much everybody in Simcoe County, right? So we deal with the guest house quite often. We deal with the other shelters, Busby, we talk to them quite often. The Lighthouse in Aurelia, CMHA for addictions support here in town, the RAM Clinic at Chigamec. And Chigamec is a huge community partner as well because they're so encompassing for all.
Sorry, what was that?
Chigamec, they're
Chigamec,
an incredible
Okay.
community partner because they're so encompassing, right? So we can get, counseling services there. They have one-off counseling sessions. There is all kinds of different programs. They're running smoking cessation programs to stop, help people stop smoking. We work with CNCC, which is, the correctional center.
Yeah.
And Waypoint as well. Waypoint is a really strong component as well with outpatients support. So we do connect people up with outpatients so that they do have oversight, that they get set up with psychiatry, as well as sometimes, they have nurses that come out and give shots and that sort of stuff as well.
So this sounds wonderful in your description of it and your list of all the partners, but where are your biggest challenges? Do they come from what's available for people, or do they come from the people themselves, or some combination? Tell us what.
The biggest challenge for us is the lack of services. Yeah, we have lots of services in our community, but they can only provide so much, right? And it's almost overwhelming. There's wait lists pretty much everywhere for most programs, and that's the biggest challenge that we face right now, is the wait lists, right? So to get somebody in to do ongoing counseling, there's through the OSP program, which is through Waypoint, which is the Ontario Structured Psychotherapy Program. It can be months waiting to get that person in to get the help that they need, right? To get a primary care provider, it can be 6, 7, 8, 9, even a year, before they get moved on that list to actually find one, right? And these are people that need that help now, right? Especially, those that are out on the street, it's very detrimental for them, right? Because, like Nathan was saying, they're living rough. They're living in the cold. They're living in the heat. Their bodies are taking a toll, right? and they're not getting the help and health care that they truly desire and need. It's the wait list that we're.
Okay, so there are definite gaps and there's wait lists.
Absolutely.
Okay.
I think you make a good point that on paper, it looks like we've checked all the boxes.
Absolutely.
And yet within those boxes, some of them it's really just a house of cards.
Yeah, but when you look at Midland in general, you go, wow, we do have a lot of supports here, but just not enough to support the people that we have, trying to get into those systems.
When I met with you before tonight, one of your big jobs is finding staff. And I guess that's a situation of all healthcare now, but how do you manage that? Like,
By having really good staff that we have now, because they're the ones that have, really stepped up during this crisis. We have gone, knock on wood right now, we have a full case management staff, but we were running, 3-4 case managers short, and still my case managers were carrying that caseload, right? So within Wendat, 12 to 15 high needs clients is what a case manager normally will run. They were doing 22 to 25, right? And they're burning out, right? And it's super tough.
are you able to train new people, Glenn, or how do you?
We do. It's getting that staff, though. Getting the qualified people. We talked about this earlier. It's really hard to find those that. One, we're a nonprofit organization, so our wages are a heck of a lot lower than Waypoint, the jail, that sort of thing, right? And to get staff that actually have that caring attitude and they're not in it for that paycheck, right? Especially nowadays with the way cost of living is going up, it's really tough. I just talked to our executive director and we just did, our yearly, plans. And last year was the highest staff turnover rate Wendat has seen since its inception, right? And that was, during COVID.
Well, the best thing for staff turnover and new staff is a good manager. So thank you for what you do, okay? You've been there a long time.
Actually, I have not been. I started at Wendat frontline. I started in crisis at the hospital, part-time casual. And then I went to brief service and then case management, right? And then I took on the supervisor role when an incredible supervisor left to another position.
Okay. I asked you to tell us a story about what success looks like in terms of somebody that's come in very challenged, living not in the best situation, not eating, medical issues, mental health issues. Do some of them get better? And what does it look like?
We have some success stories, obviously. To be honest, a lot of our case management clients are with us forever, right? They get to a certain point where they are, stable and doing well, but there's times that they do drop off and become very unwell. So it's very imperative that we, keep them, within our case management role. But we do have clients that come. I had a gentleman, when I first started in case management, he came from RVH. He was in the hospital there for 4 months. He came back to Tiny and went to stay with his parents because he did not have anywhere to go. They couldn't handle him because of his mental health. He was just so fragile and just so unwell. And his health was just deteriorated, right? So we were able to work him into the case management program and, get him set up with community supports that he needed. And this is over a 2-year period, right? So this gentleman, we were able to get him into a rooming house just to have a roof over his head. We were able to get him set up with one of the new doctors that came to town, Waves Family Medical. Like, things just kind of fell into place for him, right? We got him stabilized. We got him hooked up with outpatients at Waypoint, right? So we had a regular psychiatrist and somebody to actually monitor and regulate his medication to get him stabilized to where, he was functional. We finally got him into his own apartment. And in the last 6 months, he has come off of ODSP, gone back to work full-time, and is just doing incredible, right? But that success story comes down to the aspect of housing. It all stems from that, right? Without housing, we can't get people off of the street medically treated mentally treated, right? We can't get, a grasp on their addictions issues, because if they're homeless, they're just going back into the street and back to the same people that they've been dealing with, and it just cycles again, right? So, housing is super imperative, for holistic healing.
Thanks, Glenn. I'm sure we'll come back to you. We have more questions, understanding what you do and your organization does. We didn't touch the drug issues, drug addiction issues, and I'd like to come back to that, at least for one. But Suzanne, your turn. So we've heard nice things about Chigimik, but tell us what special populations, what does Chigimik do?
Chigimik is a community health center, and our model is based on ensuring that there's equitable access to health care and ensuring that we reduce boundaries, stigmatism, and without judgment. And that I've been in my role for 7 months now. I'm sure most of you are familiar with my predecessor, David Jeffries, who started and worked diligently with the town and with the provincial government to start and establish a community health center in Midland. Our mandate, we're very specific from a CHC perspective in terms of our model, recognizing that in North Simcoe, we have 3 pillars that we service and support, and that is the Indigenous community, the Francophone community, and we call the at-risk or vulnerable population, which I define as seniors within the community, the homeless, those who don't have health cards but need primary care, and the LGBTQ community as well. So we have a combination of primary care, so we have 4 physicians on staff, 3 nurse practitioners, 2 nurses. We're able to do blood work within our clinical side as well. We run the Indigenous Diabetes Foot Care Program, and then we have allied health services. So to Glenn's point, we are very much an all-encompassing organization as it relates to care, which is mind, body, and soul. So we offer as well counseling for addiction and mental health. We have short-term programming and support that we can provide, but we also have the ability that if you are a patient with us, you can see a counselor and have repeat sessions as opposed to just one-off sessions, which are available to anybody within the community. We offer a variety of programs that are based on Indigenous healings and practice that are open to everyone in the community, and also, programs like the Quit. We have Quit Cafe, which is a smoke cessation program that you can come in and get free products such as Nicorettes and patches to assist, and you participate in an 8-week program to stop smoking. So we are provincially funded through the Ministry of Health and Ontario Health, which is the former LHINs. And so that's how we're funded in terms of how our model works. But really it is about also treating everybody with respect and dignity without judgment, reducing any barriers to access, and that really is a key component of all CHCs in the province of Ontario, and it really is reducing those barriers and ensuring that there's equitable health care for every Ontarian, which is so imperative. And so that's who we are in a nutshell.
So you talked about people that don't have an OHIP card, i.e. they can't go into a doctor's office without paying for the visit, but they can come to see the physicians that are part of Chigimik, and there is no cost to see those physicians. So you've broken down a barrier right away, but that's the medical services. What about the other services that they might need that often cost money?
So I would just clarify that we have rostered patients, so our physicians and nurse practitioners have rostered clients. You can't just walk into Chigimik and have a medical appointment. Well, if you are someone who doesn't have a health card, you can be rostered, and that doesn't prohibit you from getting health care.
Okay.
Once you're rostered as a client, there are services that you can participate in that are counseling services. You can also participate and have sessions with our dietitian. We have physiotherapy, massage therapy.
So it's much broader than my definition of medical services.
Yes,
Okay.
yeah.
Okay.
It's that holistic mind, body, and soul. So looking at all aspects in terms of an individual's well-being, not just your physical well-being, but certainly all aspects of that well-being.
So when you started, what was the biggest surprise to you?
Biggest surprise to me. Well, I'm from this community, and so I am aware that there is, we have a homeless population, or those who are experiencing homelessness, and I appreciate that terminology. I am someone who is without bias and have been for a lot of years, and I think it's important that we all look at those who are displaced within our community with compassion and caring. And so I don't know that I was really surprised by anything that I've seen within our community. What I am surprised at, and am pleasantly surprised, is the amount of compassion that we do have as a community, and that how much compassion and caring our staff have for making an impact and helping those within our community who are deemed to be vulnerable. And I think that's what's really important. My mission being here tonight was just to reiterate that we all need to have compassion. And throughout the pandemic, not everyone was compassionate. And we saw the best of people, and unfortunately we saw perhaps things that we never expected to see from people that were really disappointing. And so I educate, I'm a mother of two, and I always think about my actions, how they impact my children. And I ensure that they understand that nobody woke up one morning and decided, you know what, I think I'm gonna have a drug addiction today. My goal is to be homeless by the end of this week. No one strives to be homeless. No one strives to have addictions. What I do support them is that if they're struggling and they need to talk, that this is often where things happen. Individuals living or experiencing homelessness are dealing with significant traumas and issues that they have had for many, many years, and have perhaps not been able to deal with them, and so have turned to substances to help numb those pains and deal with those traumas. And so I think for me is, I went into this position with my eyes very much wide open, understanding what the philosophy was, what our mission was, and what we're trying to do in the community as it relates to being a community health center. And so no big surprises, but I think sometimes what does surprise me is people's reaction to those who are experiencing homelessness who come into our facilities. We supply harm reduction products. So if anyone is looking for clean needles or the ability to use narcotics in a safe way, in a clean way, then they can come and get products from us. We partner with the Simcoe County Health Unit. Everyone also gets a Naloxone Kit so that no one is using alone or using and have a safety protocol in place. And there's lots of judgment that comes with that. And that program is meant to be judgment-free, without bias, and is to ensure that they're staying safe, that it's not our position to judge that they have an addiction or that they're using, but it's for us to ensure that they have a safe way in which to use, and that they're reminded not to use alone, and that there is a Naloxone Kit, and there is some safety procedures in place. So, yeah.
Thanks for filling us in on those details. We had a program on opioid use and addiction. We had a couple here. The most recent one was January during COVID, I remember, and there was a mother that had lost a child, and it was just difficult to listen to her. It was so terrible, the situations, and it sounds like you're trying your best to keep people out of that particular situation, so thank you. Suzanne, I'm going to switch topics a little bit here. You have a human resources background, and so people are homeless. It would be nice for them to get a job. Glenn, or Nathan, I think you said to me, there's everywhere they want people, but as soon as I take these people down there, the jobs seem to disappear, was your comment, or that it's not really there, or they don't think our people are suitable. So how can you help these people, these homeless people, take that next step of, doing something they like to do so that they are happy in a job? Jump in, any one of you.
I think one of the things that we've talked about here tonight on the stage, and I work closely with our partners here, is there is a lot of really great resources and partners in our community that help individuals build their resume. So the YMCA has a work program, and I've spoke there before in terms of just talking about, what to put on a resume, what to say, how to prepare, how you should dress, those types of things. Because, I've been in human resources for 25 plus years. I've interviewed a lot of individuals. And the biggest thing is really just how people are being prepared in those situations. An interview is intimidating, whether you've done them 100 times or whether you've never done them. If you're someone who's coming off of, living in a situation or experiencing homelessness and you're trying to reestablish, it's going to take some coaching and some job shadowing and just really some shared knowledge and doing some mock interviews with them and helping increase their confidence to be able to sit down and talk about themselves and really draw from experiences. And so, yes, there's lots of positions to be had out in terms of, jobs that are available. There are skills that are required with each of those jobs as well. And it's about empowering people to understand what skills they have, what a transferable skill is, how experiences that they've learned and that they've had, you can translate that into ways in which to obtain a job. I talk about having children, they're not young anymore, but 15 and 18, and my son got his first job. He's never had a job. He's like, well, Mom, what do I put on a resume? I said, give me 5 minutes, I can fill a page for you. And it's amazing, but it's really about, I said, you play hockey. What does it mean to be part of a hockey team? Well, I'm the goalie. I'm like, so is it important that you show up every game? Absolutely. Do you miss practice? No, because I'm letting my teammates down. Okay. So it's about understanding what you're learning from those experiences and how they become transferable skills. I would always, when you're in HR, everyone has, I just have one question for you. I've got an interview coming up. I always tell everybody to draw on every experience, not just your last job, but everything you've done in your life. Talk about your volunteer work. Talk about, work that you had 5 years ago, 10 years ago, because there's always something we've learned from each of those experiences. And although your resume may not be 4 pages, my son's was 1 page, and he was able to talk about those different things that he has done because it's about experiences in your life that are transferable skills, and I always think that's really important.
Thanks, Suzanne, for covering that aspect.
Supporting fully what Suzanne says, but I find one of the biggest issues is something as simple as having an address. Coming right back to the homeless, that you go into a job interview and the first thing you do is give a piece of paper and it's got right at the top your address. If you put down homeless, it's probably the end of the interview right there. So they do fold in on themselves.
That's a good segue into a question that I want to ask about the next step beyond a night at the guest house. And we are very fortunate in this area to have transitional homes. Tell us about transitional homes and how these people can get at least to that level, or can they? Is it difficult? Is it easy? I just saw an announcement, $3.6 million for 36 beds up here just off of Yonge Street for new transitional home housing. What does that entail, and where does the homeless fit in terms of accessing that kind of facility? Do you want to handle that, Nathan? Or
Sure, I can get it started, yeah. Well, housing, like so many things, it is a continuum. So some people will go from experiencing absolute homelessness right back into a home or an apartment, whereas for other people it does take longer. One of the things that we lost many years ago was facilities and institutions for people who required more significant daily support in their living. So transitional housing is an interesting step back to permanent housing, whereby and actually it used to be it was 1 year was the maximum. Now it's up to 3 or 4 years where somebody can live there and really develop deeper life skills, whether that's tenancy and employment, going back to school, having opportunities. One of the challenges with getting a job when you're experiencing homelessness, certainly the address on the resume, the phone number, the contact information, but also to Glenn's point earlier, when you're on the street, you are in survival mode. How do I get through today? How do I get through tomorrow? How do I get to tomorrow? And so for a lot of people, the idea of holding down a job and following through with those commitments, it's unrealistic for them where they are. That housing piece needs to come first. And certainly our preference would be that housing is permanent, But in the instance where it's not, or where that permanent housing can't be as supported as somebody needs, that's where transitional housing is great. Unfortunately, even our transitional housing in our community is really, really filled to the brink with people who don't move on as much as Shelter Now is our transitional shelter in Midland, and we are really lucky that they are expanding. But even for them, they're having a hard time with people moving on because there is nowhere for them to go. You know, that permanent, affordable housing needs to be there. If that is the bottleneck, it slows everything else down behind it, including dealing with the other issues like employment, like education, like mental health, physical health. It all stems from that housing. In terms of a housing first model, you know, the idea of housing first is that housing needs to come first and everything comes after, which is what really flipped the traditional model on its head that used to be, we're gonna sort out your mental health issues, your addictions, we're gonna get you a job, and then when we deem that you are housing ready, now we'll find you a place. And so the script has been flipped. The script has been flipped. That's not easy to say, especially not on live TV. And so now the focus is on housing first with everything coming after. And transitional housing is a great option for youth, especially because you know, some of the people that we work with have never had independent housing before in their life. And so it can be really overwhelming and daunting, especially when they don't come with a support system or a family to help them navigate those environments. So transitional housing is great. It's one more piece that we can put in place in our community. I think the hardest thing about transitional housing is bringing the supports with it. So one of the shortcomings often of that type of a long-term temporary housing is that it's expected to be somewhat independent and that your day-to-day life will be somewhat independent, which is not realistic for a lot of the people who move from an emergency shelter or the streets to those services.
Okay. Glenn, any comments on transition?
Majority, Sonia Lattiser runs the Shelter Now program. Right now, the unit that they have, we've got case management clients within that, which is great because our case management is actually called support for independent living, right? So we teach those skills, you know, so that they are able to be independent as possible, right? You know, maintaining housing, cleaning, cooking, job preparation as well, right? So they work diligently with case managers, and I love the concept of transitional housing. It's a really good program because but like you said, Nathan, where do they go after? It's supposed to be a 2-year program, but if there's nowhere to house them afterwards, there's no transition. They're stuck, right? So they're just in that revolving door, right? Now this new unit, it'll be operational hopefully in the spring, and that'll open up a few more beds, but it's not enough. It's just not enough.
Okay.
And I think what might happen too is that it's going to allow more people to get off the streets and to have that supportive short-term housing, but it will actually create more of a bottleneck as people look to move from transitional into permanent housing. And even us as an emergency shelter, we are not really an emergency shelter right now because we're supposed to be moving people on fairly quickly from our services, but people have been with us since the beginning of the pandemic, and we have not been able to move them forward yet.
I think what's been really clear to me tonight is that the housing is first and getting that solved, but you've got to do a whole lot more with people at Wendat, people at Chigamig, and wherever they get their support systems to get them to that next level, because just a house will not work at that point, right?
No.
Okay.
And it's finding that affordable housing as well.
Gord, I haven't forgotten you here. I'm sorry.
I was quite prepared to get my check and just leave.
You're seldom so quiet, Gord. Gord's had a wealth of experience, and he's viewed it over a significant amount of time. So, Gord, the floor is yours. And I know Gord wants to talk a little bit about attainable and affordable housing, but that's just another step beyond the challenge. But the floor is yours, Gord.
I appreciate that. My background has been municipal politics the last little while, and as you've heard, I've run the Out of the Cold program prior to it being taken over by truly competent people like Nathan here, so it's very, very good to see it passed on like that. I'm also head of the Task Force on Affordable Housing for the town of Midland. So just to, I guess, set the municipal landscape that we see it, municipality is not a healthcare organization, so we don't have quite the clear healthcare mandate intervention that is evident in these other panelists tonight. But we do have indirect, and I guess the two major ones, as a municipality, straight up within our mandate, is we have to deal with the county, that we're a member of county council, and they pass funds through from the province to all of these good services. So each and every one of these services up here is constrained in some ways by the funding provided by the county and the limits. So the county doesn't give you anything without saying, and here's how you'll use it, and if you violate this trust, we'll take your money away. Not quite that ugly, but so there's very limited amounts of funding available for all of these programs, which leads to the comments from Glenn in particular that we just can't get enough resources to complete all the things we'd like to do. So that's one, is dealing with the county and getting these programs organized financially, so the budget side of it. The other is policing. Policing is a town of Midland budget item. Obviously, we don't run the police department. We don't tell the OPP what to do, but we do sit with them and discuss levels of service. And we're very pleased with the way they do intervene in the public. They're very sensitive to, not everyone's a criminal. They're people that need help. They're people that are part of your society. So how do we help these people use the services and be good citizens within Midland? So those are the, I guess, the two direct ones. But I think if you've heard here tonight, if there's any word that keeps cropping up, it's the word housing. And this is the one that, again, is very confused in terms of who's responsible, both federal, provincial, or municipal, and what it means. Housing, and we've had some background discussions, is probably one of the most complex topics that we've got in the municipal realm, because everyone has a stake in it, but no one's responsible for it. You've got private players, you've got public players, you've got users, you've got interested social service agencies, all having a stake in housing, and we're all sort of circling each other trying to do what we need with housing.
Gord, that's why we asked you to talk about it.
I'll confuse everybody here.
No,
Have
you
a
won't.
chance.
No, we won't.
But
Keep going. Wonderful.
if there's anything good that's come out of COVID, I think it's caused us to stop and reflect on what we're doing. And we're starting to see the impact of this confusion with housing. Just pulling together a couple of stats, and I do this with the Task Force on Affordable Housing, that if you look at the cost of a one-bedroom apartment in Midland, assuming you can find one, which is pretty close to impossible, it's about $1,500 a month. That's all in to rent a one-bedroom apartment.
$1,500 a month?
Yes, for an all-in. It's just sort of an average as
So
to where
close
we
to
are right now in the market.
$20,000 a year. Okay.
Yeah. 42% of the economic households, that is, do earner households, 42% can't afford to pay that. So 42% of the people living in Midland right now would have trouble renting a one-bedroom apartment. So this is the scope of it. And you're saying, well, we just heard there's only about 700 in the whole of Simcoe. Midland's probably got about 200 homeless. Where are the rest of the people? And this is where the gray, fuzzy boundary comes as to what is homeless really? And I think, Nathan, you can probably speak to this as well. We have episodic homelessness, that you'll see someone in the shelter for a period, they'll disappear for a year, and then they're back. And if you talk to them, you'll find out the landlord decided they wanted them out, and there's no place for them to go, so they're at the shelter. They've lost a job, or they're between jobs, and they've got no support system. There's no wealth in the family, so you've got to go and rely upon the shelter system. So we have got a tremendous number of people in this situation of stress. So if I look at what a municipality is supposed to do, it is generally supposed to look after the well-being of the people in the community. And I realize it's a very broad, fuzzy statement as to what a municipality should do, but we usually try to boil it down into, well, you provide the sewer and the water and the taxes. It all comes back to looking through the population and see, how do we keep us all healthy, safe, employed, and looking forward as a positive community? And each and every one of those that I've mentioned, if I look at the economy, that's a simple one here, getting a job. We talk to employers and they say they cannot bring workers into town because they can't find housing for them. So I can't bring my plant in and I can't hire more people because there's no place for people to house. I look at the food. We all have to eat healthy. Well, if I am consuming most of my budget just paying for an apartment, guess what I'm eating? Not very much. And this is the trade-off that, as I said, 42% of these families are starting to make now, that I just won't have quality food because I've got to pay the rent. I look at safety in the community. This leads to all sorts of stresses that I'm not sure if I'm going to be employed at the end of the week. I'm not sure if I can take the kids out to hockey this week. It creates all of these family situations that the police and social service agencies have to intervene in. So this is the broad, fuzzy mandate that a community has got to come to grips with. I don't know if we're talking about solutions yet, but fundamentally, we have looked at housing and said, we're not getting the housing we need. And it's unlike so many other people, and it's not suggested to the panelists, but we've got to stop pointing at other people and saying, you fix it, and we've got to fix it. So this is in the town of Midland right now. The task force is looking at our resources. What can we do to put in the housing that's needed? And recognizing, yes, the homeless need this, but the homeless is that fuzzy area. It's not the 200 people that are living in the shelter and in the support system, and we can identify them, yes, check that. These are the hundreds of people that are living near homelessness. And they know a missed paycheck, a problem with the landlord, sickness in the family. I'm going to be in that shelter too. So how do I change the housing situation? I was just talking to a lady 2 days ago, and she was telling me she was living in an apartment, one-bedroom apartment, very pleased to be in that apartment, but she said, I can't afford to move. There's no place I can move, so I'm virtually locked in this apartment. And you start to realize, what does that do about your mobility to find a new job, to move with your family, if you have more children coming in, can you get a new place? And the answer for so many people, too many people, is no. And it comes back to housing. So while it's good to see all of these programs, and both the federal and provincial government have put new programs on, we have not come to grips with a significant housing problem that affects all communities in Ontario. It's not just Midland, but all of our communities, and one that needs to be taken in a much more serious fashion than how we're approaching it right now.
Gord, there's a lot of information about a country called Finland,
Yes.
who seem to at least have a good relationship with the media because they seem to have solved the problem of homelessness. So they say, I think they've reduced the amount by about a third. It's quite a significant number, so they say, but I don't know how they count it, but anyway, that they have made some inroads. What did they do? Can we do that? Are our cultures just so different? Because I think there's far more social services in Finland than there is here.
Yes.
Comments?
Well, now I think we've heard it up here, and I've already commented on budgets, that yes, we can have more social services, but at the end of the day, someone's got to pay for them. And we all have this deal with the residents as to how much are you willing to pay for community supports. And at the election time, of course, we decide where the cut point is. So if we put in a government that's bent upon austerity, that we're going to cut back on this service and that service, that is the situation you get. The Nordic countries are recognized as being very tax heavy. They have an awful lot of services embedded in there. Plus they've got a culture of supporting each other. And I guess this comes from living up north where it's cold, where you better get together to stay warm in the wintertime. But they do reach out and said, how can the state intervene in your private life and maybe make schooling available, make sure that there's long-term care on your street, and provide these services that do cost more, but they're ones the citizens want. And I'd have to say in general in Canada, our discussion with governments, this balance that we've struck, does not permit us to do that right now.
I'm impressed at all the services that we do have.
Yes.
Like it's amazing to hear you people talk about what's available. But then when I hear about wait times and not all services because we just don't have the manpower, or we just can't get there, all the log jams along the way. So what did Finland do to get to that stage?
Well, as I said, you've got to, at some point, pay the piper. If you're going to put 20 social workers in the field, you've got to pay for 20 social workers. Right now, in many cases, we have put the service out there, but we've only put 10 in the field. And frankly, I'd have to go back to the county now and ask them for more money, and they'd have to go back to the province and ask for more money. And in the typical scenario is that, well, I've got the whole province to run, and that's all the money we've got in this particular portfolio, so that's it. Do what you can with this. So it comes right fundamentally back to, what are you willing to pay for? And we have decided right now that is as much as we wish to contribute to this. Long-term care is a primary example. That there's all sorts of excellent models from especially in Europe, as to what can be done to improve that. But it takes a complete change as to who is providing the service and how they're being funded to affect that change. So the question for the people and for the politicians is, are you willing to go that route?
One of the things that I'm going to change topics a little bit here. One of the things that you've talked about, all I think, except for Gord, is the volunteers that work in your organizations. We have not necessarily stressed the philanthropy of the organizations or the goodwill or the volunteer part, but I'm hearing tonight from several of you that, you know, fundraising and volunteers are an integral part to making this work here in this community now. Tell me what you need in terms of volunteers, what you need in terms of philanthropy. Who wants to start? Nathan, don't exhaust the list, okay?
Well, the guest house started as out of the cold, and it was entirely volunteer driven up until I think 2015. For 12 years, it was 100% driven by volunteers. Some of the reasons for the shift towards paid staff or the challenges that our guests experience can be complicated. And so, you know, having professional staff is great, but volunteers are so essential. There's so much more that we can do with the power of our volunteers. Unfortunately, with COVID, you know, that really stopped. We had to take safety as our first priority. And back in the early days when we just didn't know, we really stopped the volunteer program. And a lot has changed over the last 2.5 years. A lot of our volunteers were advanced in age, and a lot of our volunteers have just moved on. And so it's almost like starting again, but being aware of the challenges that we have now. We're being safe and different priorities. But volunteers do everything from help to cook meals, to get the word out, to provide support to our guests, to play cards. There are outside events that we do to help raise money. There are committees, and so volunteering is really key. The other thing about volunteers is, by nature, they are people that care. And so even just having that energy, having that passion, knowing sometimes as a social worker, it feels very lonely. It feels almost like we're on an island of ourselves sometimes. And so knowing that there's that community support can also be a real boost just for the morale of the guests and the staff. But something that needs to almost be reinvented again in our communities.
Yeah.
And
Can you
Keith, I think
talk about volunteers and donations in your organization, Suzanne, and then Glenn? So, do you have volunteers?
Similar to Nathan, so we did have volunteers assisting with various programs and services, but since COVID, it's been about, you know, prioritizing everybody's safety and well-being, and so we haven't had volunteers back at Chigamik. And to Nathan's point, I think we're all looking at, you know, what do volunteer programs look like as we move forward, and they almost need to be reinvented from that perspective. But I do have to agree, individuals who are philanthropic by nature are volunteers and want to do good and help and do what they can to better others' lives within this community. And there is a need to see that restart again. But, you know, we're not completely out of this pandemic either. And I think, you know, we are coming to the other side, and, you know, we still have to wear masks within our facility. And, you know, I can't wait for the day that we're not. But you know, everybody's, those who want to get back out into community and help, you know, certainly, hey, give me a call. I'm more than happy to put you to work.
Glenn?
At Wendat, we don't really rely so much on volunteers other than for doing our bingo. We do a lot of fundraising, but a lot of it's internal. Like our staff, our management team will actually go out and work the golf tournaments and that sort of thing. We do employ some of our clients downstairs in our programs. We used to have volunteers, but we found that it was more inducive for us to actually train them to actually be staff, right? To actually give them that job opportunity and you know, work in our programs downstairs, right? To just kind of set them up in the community.
But you do also have an active fundraising portion for Wendat too?
Absolutely,
Right?
yeah, especially when our seniors home in Penetang, you know, almost $100,000 we need per year just to keep that afloat, and that is fundraising, right?
This community's been very lucky that in some ways with the philanthropy.
Absolutely.
It's never enough, we know that.
No,
but we've been-
absolutely. You know, and we've been
Yeah.
blessed by, you know, the golf tournament, you know, the mayor's golf tournament, and we have some great, you know, community support with with Andy from Boston Pizza. You know, he does a golf tournament every year for us, and we buy a van. Like, and that's what it's designed for, right?
And Keith, I think it's important to recognize that without some key philanthropic gifts, some of these institutions wouldn't exist.
Absolutely.
Shelter Now is a prime example of that. Yeah. GBGH is another one in terms of its current estate. So we've got some amazing people in our community who really have stepped up and built an awful lot of our social services.
Yeah.
I think one of the problems with volunteers, though, is that people are tired. You know, it feels like what we've just been through, I think everyone is feeling it. You know, there's a little bit of trauma that everyone had, regardless of how closely COVID touched people, and so it is tough right now. The other problem, I think, when I speak to a lot of volunteers is returning to a world where the need is still there, but it doesn't feel like there's as much light at the end of the tunnel right now. The elephant in the room is housing. We're all talking about it, and yet it still feels like it's the unaddressed elephant in the room. The cheapest thing that you can do as a community, as in a society, to solve homelessness is to build affordable housing and provide it to people. Hospitals are way more expensive. Jails are way more expensive. Emergency shelters are way more expensive. You know, relying on police and other emergency services, that's all very expensive to taxpayers. A permanent roof over your head with services that come into the home and help, that is actually the most affordable way to address this. But it is front-loaded, where we need to build the housing and pay that bill up front in order to enjoy the benefits of it down the road. And that's where I agree with Gord, that we need to decide, are we willing to do that or not? Or do we continue putting Band-Aids on these problems, knowing that they're not going anywhere? And I think that's tough for volunteers. That's wearing on volunteers as well as staff, where you see the same people over and over again, and you feel as though there is no next step for them. It can be as hopeless for staff and volunteers as it can be for the people going through it themselves.
Thank you for that dose of reality.
Anytime.
Okay, so I'm going to break for about a minute and a half to talk about our sponsors and about our next program. Normally I do that earlier in the program, but tonight we left it till a little later. So there, we've got a slide up. That's great. So we have 7 very supportive sponsors, and I want to tell you something very special this year. All of these sponsors were around last year and chose to sponsor us again this year. And that is an amazing indicator of their ongoing support to the community because of an educational program, and to us in the Our Health program that we know that they're helping us to put on the program. So those 7 sponsors are Audia Hearing Aid Center with offices throughout Simcoe County, Georgian Bay General Hospital, a longtime supporter of our program, the Center for Psychology and Emotion Regulation, headed by Anita Federici, Hillcrest Village Care Center, a long-term care home managed by the Enns family, Mink Insurance, led by David Mink, now known as McDougall Insurance, Lois Lipton, now with a new company called Georgian North Real Estate, but still providing commercial real estate and development services in Simcoe County, and Waypoint Center for Mental Health Care, our newest sponsor in the last couple of years. So to all of them, a big hand. Thank you. Our next program is called Be Happy. So that's 6 weeks from tonight. Not tonight, it's on a Wednesday night instead of a Thursday night. We're doing a switch here. The event's for all of those who want a bright spot in our day. That includes me, that includes all of our committee. It's time to start thinking a little bit more optimistic, and what does that look like, and how do we get there? It's for all of us. I'm delighted with our speakers, delighted with the concept, and look forward to seeing you all 6 weeks from last night. And the promotional material will be out shortly, either at the MCC here, through our personal emails, and through Twitter and Facebook. I have 3 other announcements. I'll just be quick on them here. Our Health program has dealt with a couple of events on cancer, become very engaged in terms of those who support the Terry Fox Run and the raising of money for research. And that Terry Fox Run is 2 days from now. Yeah, it's on Sunday. Sunday, September the 18th. You can Google Terry Fox local things, the heart of Georgian Bay, or wherever you are, Barrie, Aurelia, and it's a great cause and wonderful camaraderie if you can go out to that and help out. The other one I'm going to mention is starting Monday here at the Midland Cultural Center is the inaugural Indigenous Arts and Culture Awareness Week. And there's participation at workshops, music concerts, art fairs, book fairs, and there's even a boat visit to Beausoleil Island. So look forward at the MCC online for their activities coming up, and that's next week. And as I always do, I put a plug in for the next blood donor clinic, and that's Saturday, October the 8th, between 9 and 1 p.m. So we will get back to our questions, okay? Thanks. We haven't talked about stigma of people who are homeless or who have mental health problems, who are an addiction problem. Can you talk to us about stigma and how we can break some of that down? Who wants to start this?
Well, I don't mind starting.
Sure.
I think it comes down to what Suzanne was talking about, and that's empathy for people, right? It's seeing them for being a human being, not the mental health, not the addiction, right? The mental health, the addiction, that leads back to underlying issues, right? There's other things in their life that created that addiction, right? That drove them to be there, right? The stigma is still, it's still out there, and it's huge, right? When somebody sees a homeless person on the street, a lot of people are thinking, oh, well, what, like you said, why don't they go get a job? Why are they homeless, right? It's seeing it through their eyes and knowing that they have a story, right? That they didn't choose to be there. They don't want to be there, right? The majority of them, I tell you right now, if you were to say, here, got an apartment for you, I'm going to help you get on your feet, they're going to say yes. And be thankful for that and grateful, right? With mental health, we see that all the time as well. It's the stigma, right? Because with mental health, people can be very well and functional, and you don't know anything until they're unwell, right? And when they become unwell, we see it with landlords a lot, right? People are afraid, especially when it comes to schizophrenia and that sort of stuff, when people are hearing voices or seeing visual hallucinations. You see them on the street as well, just talking to themselves, and people look down on them instead of seeing them as human beings, right? And looking at it as a disease, right? People don't see mental health as an actual illness when it in fact really is, right? And that's the stigma.
The background. Suzanne, you and I had a discussion about stigma. I know you talked about it, even how personally with your family you kind of break down those barriers. Do you want to carry on with the conversation a bit?
Yeah, I think compassion, empathy, and seeing people for who they are as individuals is really important. And like I said, as a mother and someone who is, from this community, is being aware and not saying that it doesn't exist here, because encampments do exist within our community, and because they're hidden, there's this sense that they don't exist. And there's also, I get a sense that since the pandemic, as the hoteling program has ceased, there was this sense that, the problem was solved during the pandemic. That's not what the case is now. And
Just delayed.
Yeah, and it's about having that compassion and just understanding and just realizing. And again, it's something I say to my kids on a regular basis, and even with my friends. Nobody woke up this morning and decided they were going to be addicted to a certain narcotic, or they were going to be homeless today. This is a result of things that have happened throughout their lives, and we have to remember we all go through traumas on a regular basis. It's how we deal with those things, but it's remembering that there's a human that you're looking at and seeing, and having that compassion and that empathy. There's nothing wrong with saying good morning, how are you?
Gord, can I hold your thought, and I'll come back to it if I've got one more question, and I'm kind of mindful of the time here. So I'm going to ask this to all of you. One thing that will make a difference to the homeless population, and I'm going to make this a little difficult, because whoever goes first has got, it's going to be housing, right? So, but it's what follows that I'm really interested in hearing. So can the four of you handle that in the next couple of minutes? Who wants to go first? Gord, you go first, so I have.
Okay, I'll take the easy one, housing.
Housing, okay. Okay.
I would say ensuring that they understand where to access services. That is a big thing. We talked about it tonight. There's a lot of really great services and programs within our community. And it's not easy to navigate. So it's understanding and working with someone to help them access those services.
Glenn?
Definitely, it supports, right? It's meeting people where they're at, right? And figuring out exactly, what order of support they need and getting them that support so that they're not waiting.
Okay. Nathan, we've left you in the hot seat because we've got lots of good ideas here.
Well, for me, I think legislation is an important one. Prior to the 90s, affordable housing was a federally mandated thing. And it was during a period when housing was fairly affordable, interest was high, but prices were low. And the legislation got downloaded into provinces who then said, well, we can't afford this, who downloaded to municipalities who said, well, we definitely can't afford this and it's not even really our thing. And then it just got lost, and it's been lost. So the idea that homelessness has been around forever is true to some degree, but it hasn't been the crisis it is until that legislation fell off the table. And I think it needs to come back, and the way it will come back and stay is programs like this as well, maintaining education. I think one thing that we didn't really talk about tonight was some of the stories, because you can get fooled with numbers and saying, wow, that's a big number, but it doesn't really tell the story of how Jim got there, or what Susan's really going through. And to your point, Suzanne, the other thing you'll never find is a teacher who asks the kids in their class, what do you want to be when you grow up? No one is ever going to say somebody living on the streets. No one's ever going to say someone with an addiction. You go from where you have hope to where there's hopelessness. And so for us to solve that, we do need legislation. We need accountability on all levels of government to make sure that it doesn't get left to the private sector to solve it.
Okay, thank you. Thanks to the four of you. I'm getting the hook. It's time to quit. But before I do, I want to thank you, the audience, whether you're here in front of us at the MCC, whether you're on TV or online. Thank you for joining us. I hope we accomplished our goals that I set out at the beginning. To our four speakers, you've done an absolutely wonderful job. And we never know how it's going to roll out, but you complimented each other. You had a message for us all, and you said it passionately. Nathan, your work that you're doing at the guest house, and you got to come, and I've watched you. You come to work with a smile on your face every day. Like that's got to mean a whole lot. Glenn, your experience at Wendat and what you do with all the other people at Wendat and the services you provide, amazing. And Suzanne, good luck in your new role. You've certainly got the passion to do that job and a good understanding from what you presented tonight of what Chigamig is all about. So, and Gord, thank you for being the wise steward. Thank you for providing an overview and your experience through many years and the many roles that you've had here in Midland. So thanks to the four of you. Thank you very much. So you can watch the program online or on TV over the next few months if you want to see it again, or tell your friends to do that. And one final message, don't forget to book your bivalent COVID shot, booster shot, whenever you can, because they're available. Good night, everyone. We'll see you for Be Happy in 6 weeks.